Good afternoon. Ako ay si Jenrid A. Trono from Group 4 at nandito kami ngayon para i-discuss ang occupational health hazards. So meron tayo ngayon na apat na hazard sa topic na ito. Ang una ay physical hazard, chemical hazard, biological hazard, at ergonomic hazard. Ano ba ang ating objectives? I-discuss and explain common hazards in the workplace and their effects to the worker's health. Recommend appropriate measures to prevent occupational and work-related illnesses. Occupational health. Promote and maintain the highest degree of physical, mental, and social well-being of workers of all occupations. Prevent workers from departures due to health caused by their working conditions. Protect workers in their working environment from hazards and risks, usually causing adverse health effects. Place and maintain a worker in an occupational environment adapted to his/her physiological ability. Hazards and risks. Ano nga ba ating hazard and risk dito? Hazards. Any source of potential damage, harm, or adverse health effects on something or someone under certain conditions at work. Risk. The chance or probability that a person will be harmed or experience an adverse health effect if exposed to a hazard. Ito ang ating unang topic ngayon, ang chemical hazards. Chemical hazards. Ito ang mga routes ang pag-enter sa ating katawan ng mga chemical hazards. Ang una dito ay ang inhalation sa ating mga paghinga. Ang pangalawa ay ingestion sa ating pagkain at skin contact. Ang mga routes naman natin ng excretion ngayon ay syempre ang una ay ang pagdumi, pag-ihi, paghinga, at sa balat natin ang paraan sa pagpapawis o sa buhok o sa mga kuko. Measures of concentration of toxic substances. Threshold limit value or TLV. Average concentration of an airborne substance to which most workers could be safely exposed over an 8-hour working day or 40-hour working week throughout a working lifetime. Maximal allowable concentration or MAC. Peak or maximum concentration of an airborne to which most workers could be safely exposed. Classification of toxic effects. Local toxicity occurs at the site of chemical contact. Systematic toxicity occurs distant from point of contact, may involve many organ systems. Acute toxicity occurs almost immediately, hours or days after an exposure. Chronic toxicity represents cumulative damage to specific organ systems, occurs many months or years to have recognizable clinical diseases. Health effects. Renal diseases, respiratory diseases, skin diseases, hematologic diseases, cardiovascular diseases, neurologic diseases, carcinogenic, and teratogenic. So ito ang mga effects na pwede makuha sa chemical agent at saan industry o process natin itong nagagawa. Example nito ay yung acute o chronic renal failure. Nakakuha to sa agent ng mercury, cadmium, o chloroform. At ito ay nakuha sa work natin o process natin sa battery, chemical industries, at pesticides. Irritation, inflammation sa solvents, ammonia, at ito ay sa chemical industries. Pneumoconiosis sa mga inorganic dust, ito ay nagmumula sa mining, construction, sandblasting, at coal. Cancer sa chromium, ito ay sa plating o metal refining. Anemia, nakuha natin ito sa lead o lead, at ito ay nagmumula sa battery, MFG, o lead smelting. Aplastic anemia, ito ay nakuha sa benzene at sa pagsosolvent and soap, MFG. Allergic contact dermatitis, plastic epoxides, plastic varnish. Acne, nakuha natin ito sa mga cutting oils or grease, at ito ay nagagamit sa machine tools operators. Skin cancer, nakuha ito sa arsenic tar, at ito ay sa pagpe-petroleum refinery. Nakuha din natin dito mga liver diseases katulad ng acute liver toxicity. Ito ay nagmumula sa carbon tetrachloride, at ito ay nagmumula sa cleaning ng fluids o dry cleaners. Liver cancer, nakuha natin ito sa vinyl chloride. Ito ay nagmumula sa plastic and vinyl chloride, MFG. Pwede rin natin makakuha ng cardiovascular diseases katulad ng hypertension, nagmumula sa lead, cadmium, at ito ay sa battery energy and recycling. Atherosclerosis, nakuha nito sa carbon disulfide, at ito ay sa pag-decreasing dry cleaning. Arrhythmias naman sa fluorocarbon o trichloroethylene, ito ay sa refrigeration or solvent workers. Yan lang po sa chemical hazards. Thank you po.
And we have here the physical hazards. It is an agent, factor, or circumstance that can cause harm with contact. Then we have 5 physical hazards: the noise, vibration, extreme temperature, illumination, and radiation. First one is the noise, as we can see around an airplane, machines, water, cars, and tools, and a train. And we have the ear anatomy. And we have types of noise-induced hearing loss. The first is temporary threshold shift or auditory fatigue, where we lose our hearing temporarily and recovers within 16 to 48 hours. Second one is permanent threshold shift, or the irreversible loss of hearing. The early signs of hearing loss are difficulty in understanding spoken words in a noisy environment, need to be near or look at the person speaking to help understand words. Familiar sounds are muffled, complaints that people do not speak clearly, and ringing noises in the ears called tinnitus. And the other harmful effects of noise are hypertension or high blood pressure, hyperacidity, also known as gastritis or acid reflux, palpitations or abnormal fast heartbeat, and disturbs relaxation and sleep. Physical hazard is vibration. Physical factor which affects man by transmission of mechanical energy from oscillating sources. The effects of vibration, segmental vibration, and full body vibration. Segmental vibration affects section of the body, specifically the hands and the feet. Health effects are hand-arm vibration syndrome, tingling, numbness, blanching of fingers, and pain. And the whole body vibration, this is when vibrations of any frequency are transferred to human body. So the health effects are fatigue, irritability, headache, and disorders of the spine. The third one is extreme temperature. So we have the sources of heat stress, natural conditions, and hot work processes related to furnaces, kilns, boilers, and smelting. So we have the disorders and clinical features. Prickly heat or miliare rubra, the protric rash, heat cramps or cramps in the body, usually the legs, heat exhaustion, dizziness, fainting attack during a vision, cold, clammy, and sweaty skin, and heat stroke, the cyanosis, muscle twitchings, disorientation, delirium, and convulsions. So we have source of cold environment, ice plants and freezers in the food industry. So the health effects of cold temperature is frostbite or reddening of skin, localized burning pain and numbness. Fingers, toes, cheeks, nose, and ears are most susceptible. And the trench foot or immersion foot, the numbness, pain, cramps, ulceration, and gangrene. And then we have inadequate illumination. The health effects are visual fatigue or when the eye muscles tighten when focusing on something. The double vision is when we look at one object but see two images of it. The headaches, painful irritation, lacrimation, or tearing abnormally or excessively, conjunctivitis, inflammation or infection of the transparent membrane that lines your eyelid and covers the white part of your eyeballs. Then we have radiation. There are two types, the ionizing and the ionizing. Ionizing comes from X-rays, gamma rays, and the health effects are cancer, congenital defects, and death. The non-ionizing comes from ultraviolet, infrared, and laser that affects our health, skin redness, premature skin aging, and skin cancer, corneal and conjunctival burns, retinal injury, and cataracts. Then, skin and eye problems. Thank you.
Hi, I am Oriel Nomelseus B. Rojas, and I will tackle biological hazards. Ano nga ba yung biological hazards? Ito yung mga viruses, fungi, bacteria, or parasites na maaari natin ma-inherit sa pamamagitan ng pagtatrabaho ng pangmatagalan. Example, agent diseases, colds, influenza, scarlet fever, diphtheria, or smallpox. Ang mga makaka-inherit naman daw nito is yung mga taong kung saan-saan nagpupunta. Tuberculosis. Yung mga makaka-inherit naman daw nito is yung mga tao or silica workers, people exposed to heat and organic dust, and medical personnel. Anthrax. Animal handlers and handlers of carcasses, skins or hair of infected animals, including wool, carpet processors, and handlers. Ringworm in horses, cattle, deer, pigs, cats, dogs, birds, or other animals. Ang makaka-inherit naman daw nito is yung mga nagtatrabaho sa pet shop, stockmen, breeders of cats and dogs, and other animal handlers. Tetanus, makaka-inherit naman daw nito is yung nagtatrabaho sa farm, or yung mga nasusugatan ng bakal na may kalawang. Rabies tulad ng dogs, bats, cats, pigs. Ay yung mga makaka-inherit naman daw nito is yung veterinarians, letter carriers, laboratory researchers, agricultural workers, and yung mga tao na bigla-bigla na lang makakagat ng mga hayop na ito. Fungus. Makaka-inherit naman daw nito is yung farmers, outdoor workers, and animal handlers.
So, ergonomic hazard. Human biological science, engineering science equals to maximum satisfaction and increased productivity. So, ang ibig sabihin ng ergonomics is para maging comfortable, like comfortable yung mga nagtatrabaho and hindi sila discomfort sa mga pwesto nila or mga gamit nila, ganun. Para mas yung productivity ng pagtatrabaho nila is parang tuloy-tuloy and parang walang sagabal. So, ergonomics. So, yun. The task, job and context. Like, pagka sinabing job and context, kung ano nga ba yung quest mo or task mo as that person. Like, kunwari, isa kang encoder. So, if encoder ka, ginagawa mo, nag-encode ka ng mga ano. Yun. So, the tool. Yan naman yung mga parang gamit. Like, gamit mo. So, kung encoder ka, what do you use? Of course, PC. Yun. Workstation. So, common na yan. Yung kung saan ka like, saan yung pwesto mo or saan ka nagtatrabaho, ganun. Then the environment. So yung environment na inaanohan mo ngayon as worker. Like most of the time marami sa mga OFW, yung mga like kuwari sa Saudi, ganun. Minsan malamig, Like sa ibang lugar may malamig, may mainit, ganun. So it matters pa rin. Then the last is the organization. Like kung anong organization ba yung ano. So the goal ng ergonomics to reduce work-related musculoskeletal disorders or MSDs developed by workers. So pagka sinabi nating musculoskeletal disorders, ito yung ano, yung mga kayang umaffect sa'yo, I mean sa katawan mo. Like, kunwari, ano ba, ulikat. Yun, possible yun. Like, yun yung mga MSD, yung like hindi ka comfortable, like naapektuhan lahat yung sa may katawan mo. Na to the point na pag naapektuhan na yung sa katawan mo, it can cause dun sa may ginagawa mo, like sa trabaho mo, ganun. Like, kuwari, hindi ka na makapaggawa ng ganito kasi masakit yung likod mo, hindi ka na makapagbuhat or whatever. Yun. So, ergonomics. Common symptoms of MSD. Painful joints. So, yung mga masakit daw na joint. Yun, mga tuhod, something, mga ganun. Pain, tingling, numbness in hands, wrist, forearms, shoulders, knees, and feet. So, yung pagkaano daw, yung pagkamanhid na ng mga yun, kamay, wrist, forearm, shoulders, knees, and feet. Then, shooting or stabbing pains, like yung mga parang kirot-kirot, ganun. Swelling or inflammation. Yun. So, ito pa yung ibang common. Yung fingers or toes turning white. Ano nga ba yun? Pag sa turning white, parang namumutla na yung ano mo, yung wala ng dugo. Ganun. Then back pain or neck pain, tas stiffness. Then ito yung mga risk factor ng mga ano, ng mga ergonomics. Static posture. So pag sinabi nating static posture, yan yung parang nasa isang pwesto ka lang, di ka gumagalaw. Like, kunwari, nakaupo ka lang, then yung pwesto mong ganun, sabihin mo 4 hours, 5 hours, ganun. Usually sa mga ano yan mga nagtatrabaho ng call center. Kasi syempre dapat attention nila is nandun sa may customer and di na rin sila nakapag ano ng pwesto, like nakaupo lang sila all night, all day. Yun. Then forceful exertion. Ito yung mga parang pinipilit mo. Kunwari mga construction workers na mga like bago. Like kunwari construction yung ang isang construction worker is usually kaya niya lang bumuhat ng sabi natin 10 kilograms, but pinipilit niya na magbuhat pa ng doble nun, like 20. Then pinilit niya na ano, and then yun, may factor din yun na pwedeng mabalian or mag-swell ng pain sa muscles nila kasi para mapabilis yung trabaho nga naman nila, di ba? Pero mali yun. Then, repetitive movement. Yan, repetitive movement. Like, paulit-ulit na ginagawa mo. Paano ba? Like, kunwari, paikot-ikot ka, supervisor ka, ganun. Paikot-ikot ka, syempre. Titingin ka ng mga ganto ganyan or mga then, syempre nakatayo ka, then pabalik-balik ka. Syempre, may factor din yun na sumakit yung muscles mo sa legs, sa paa. And yun, mag-cause ng MSD. Can cause MSD. Extreme range of motion. So, ang extreme range of motion naman is yung parang sobrang pagkabinat mo. Like yung pinipilit mong abutin kahit na hindi mo naman abot. Like, kuwari mo, inaabot mo yung pala, kunwari, ganun. Then, di mo naman siya abot na kaysa tumayo ka, itatry mo na lang na abutin, then yun. May cause din yun na pagka ng tissue sa muscle, pagka-break. Then awkward posture. Ayan, yung mga hindi comfortable na pwesto. Like yung alanganin. Alanganin na pwesto, kunwari. Like, kunwari, nakaupo ka. Like, naka-Indian hindi naman Indian seat. Yung, kunwari, nakabali yung isa mong paa. Like, naiipit na ang puwet mo yung isang hita mo, ganun. Then, isa mong legs. Then, kunwari, nag-welding ka, ganun. Siyempre, hindi naman comfortable yun. May cause pa rin yun ng numbing something and MSD pa rin. So, ito yung yung proper posture ng kapag kailangan mo head and body straight with shoulders relax. So, dapat relax lang. Then, yung eye level mo sa monitor is dapat pantay. Then, fingers are relaxed with wrist in neutral position. Then, yun. Like, comfy yung yung wrist mo sa paghawak mo sa keyboard. Upper arms, vertical elbows are close to the body, forearms horizontal. So, dapat daw, yun, na close yung elbows mo sa katawan para daw mas comfy. Then, ayan, work surface, elbow level, feet to the ground that are supported by footrest. Back seat is adjust to the feet, the lumbar region of your spine. So, yung dapat daw comfy yung sa likod mo, like yung sa may pagsandal, para ma-avoid yung mga possible na para scoliosis, ganun. Then chair height, yan. Yung height ng chair mo na that comfy. Yan. Then stress. Pag sinabi natin stress, ito yung physical and emotional responses that occur when the requirements of the job do not match the capabilities, resources, or needs of the worker. So, ang stress usually na natin to sa kapag usually nararamdaman, kuwari, tayo as student, usually stress tayo kasi maraming ginagawa. Ayun, syempre naapektuhan na yung physical and emotional natin, lalo sa emotional. Lalo ngayon kasi pandemic. Ayun. Then, rin, damay din sa physical kasi syempre, you choose to like gawin na lang than kumain or mag-exercise or whatever. Yan. And then effects. And headache sa brain and nerves, headache, despair, feelings of despair, lack of energy, sadness, nervousness, anger, irritability, decrease eating, trouble concentrating, memory problems, sleeping, mental health problems, panic attacks, anxiety disorders, and depression. So sa skin naman, mga acne daw. Then may yung iba pang skin problem. Sa muscles, yung sumasakit, yung mga likod, neck, likod, yun. Shoulder. Then yung heart mo raw is mas mabilis parang tumibok. Tapos tumataas yung blood pressure. Tapos increased risk of high cholesterol and heart attack. Then sa stomach, nausea, stomach pain, heartburn, weight gain. Then pancreas, increased risk of diabetes, increase sa intestine, diarrhea, constipation. Then reproductive system, irregular painful periods, etc. So, ayan. So, manifestation of stress. Psychological, syempre, kung stress ka, ayan, madalas mong nararamdaman tong mga to, like psychologically. Fatigue, yung pagod. Anxiety, ina-anxiety ka. Yung tension, yung tas irritability, yung pagiging, pikon, pagiging di naman pikon, irritable. Like, mabilis ka ma-irritable. Ganun. Tas depressed, yun. Tas boredom, tinatamad, inability to concentrate, like wala ka ng focus. Focus sa goal. Low esteem. Yan, parang pagka-down mo sa sarili mo. Then physiological, yung heart rate. Sa heart rate, yung parang, yun nga, mabilis yung tibok ng puso. Like, basta mabilis. Then blood pressure. Mataas nga din blood pressure. Then indigestion. Then behavioral drug use. Wala naman siguro alcohol intake. Like, ayan, pag-iinom, heavy smoking, yan, pa mga nagyosi. Impulsive emotional behavior. Like, pagka sinabing impulsive, parang grabe na yung galit. I mean, hindi naman yung galit. Like, grabe na yung emotional mo. Pare, pagka umiyak ka, like sobra. Yun. Tapos poor work and family relationship. Like, naapektuhan na rin yung sa may pagtatrabaho mo kasi stress ka na. Like, ang goal mo na lang is tapusin without the goal. Like, yung hinahanap na dapat na like parang minamadali mo na lang kasi gusto mo na matapos kasi sobrang stress ka na. Then family relationship, yun, mga pagka mo, like family relationship, pag sa family relationship, yung sa mo, parang di ka na masyadong nakipag sa family mo, ganun. Social isolation. Ayan, parang pagiging isolate mo na sa ibang tao kasi dahil sa stress, like syempre psychological and physiological affected. Like, gusto ang nasa isip mo na lang is to finish the work. Then in family abandonment, yung parang di mo na pinapansin halos. Like, ang ginagawa mo na lang is focus ka na lang dun sa may work. Then sleep problems. Ito, madalas yung sleep problems. Like, hindi ka na minsan makatulog because you always think na baka kulang or baka may mali, baka may sobra. Ayun. Like, naapektuhan ka na hanggang dumating sa point na hindi ka na makatulog. Kakaisip. So, yan. Picture. So, occupational health programs. So, like, yung occupational health program namin is to health protection. Protection, like, para maprotektahan yung health natin. Then, health promotion, like, promote it so we can protect it together. And health rehabilitation. Then, ayun. Health and safety programs. Ito, inano na kanina. Mga iba kong kagroup. Then, yan. Then, health promotion, physical activity, nutrition, weight reduction. Ayan. Physical activity, health, nutrition. Like, pagka mo, physical activity, something. Ayan. Immunization, smoking cessation, HIV/AIDS. Ayan. So, yun lang. Thank you sa pakikinig.